INNOVA Advancing Care for Neurodiverse Families. Sarah Awad,
Jamila Cutting.
Kiana Johnson.
Matayo Ogundele Ajibulu.
and David L. Collins.
The mission. The goal is to identify the gaps in services related to clients who have been diagnosed with ADHD and autism spectrum disorder. The mission of INNOVA is to close this gap by offering family counseling and advocacy services grounded in Brenner's biological model and family systems theory. By strengthening family communication, building advocacy skills, and promoting equities, INNOVA supports resilience and long-term well-being of children and their families. Next slide. The population of the diagnosed, there has been a documented rise in autism diagnosis with the ratio of being 1 in 63 students, which equates to 18,817 students diagnosed by the 2022-2023 school year. The rise in autism spectrum disorder diagnosis can be related to genetics, along with predisposition to toxins, issues during birth, and the health of the mother before and during pregnancy. With ADHD in Indiana, there has been a 13.4% prevalence between 2020 and 2023, according to the CDC, whereas a national survey of children's health, there is an estimate of 153,000 children who have ever had an ADHD diagnosis. Due to the rise in both of these conditions, it is obvious that the additional facilities offering services and trained staff are needed to successfully administer these much needed services. Many people are not getting diagnosed at all due to the funding and long wait times. Insurance coverage for autism spectrum disorder testing can be a challenge, as some insurances do not fully cover autism related services. Out of pocket costs for autism spectrum disorder testing can range between $1,000 to $2,500, as there are a variety of tests and evaluations used to determine autism spectrum disorder. To receive a Medicaid waiver for testing, if an individual is eligible for Medicaid, the wait time for the waiver can be 23 months or longer. Also, because of people being misdiagnosed or underdiagnosed later in life, especially in the case of women, the lack of resources could have a negative impact on a person's development in several aspects of their life. Autistic individuals tend to have exacerbated conditions such as stress, issues with bullying, alienation, and exacerbated health issues, issues with the law, and issues with employment and maintaining employment, etc. These findings have also been discovered about individuals with ADHD. If this is the result of a diagnosed individual with ADHD and autism spectrum disorder, just think of the life of an individual that has not been diagnosed. All right. So, in regards to the challenges, there have been a documented rise in autism diagnosis with the ratio of 1 in 63 students, which equates to 18,817 students diagnosed by the 2022-2023 school year. The rise in autism spectrum disorder diagnosis can be related to genetics, along with predisposition to toxins, issues during birth, and the health of the mother before and during pregnancy. With ADHD in Indiana, there has been a 13.4% prevalence between 2022 and 2023, according to the CDC, whereas the National Survey of Children's Health stated that there is an estimate of 153,000 children who have ever had an ADHD diagnosis. Next slide. Rise in these conditions, it is obvious that additional facilities offering the services and trained staff are needed to successfully administer these much needed services. Many people are not getting diagnosed at all due to funding and long wait times. Insurance coverage for autism spectrum disorder can be a challenge, as some insurances do not fully cover autism related services. Out of pocket costs for autism spectrum disorder testing can be range between $1,000 to $2,500, as there are a variety of tests and evaluations used to determine autism spectrum disorder. To receive a Medicaid waiver for testing, if an individual is eligible for Medicaid, the wait time for the waiver can be 23 months or longer. Also, because of people being misdiagnosed or diagnosed later in life, especially with women, the lack of resources could have a negative impact on a person's development and several aspects of their life. Next slide.
Our core services for neurodiverse families. INNOVA was designed to meet the growing needs of families with children who have ADHD or autism. Our approach centers on two main services: family counseling and parent coaching with advocacy workshops. Through family counseling, we help strengthen communication, reduce stress, and create supportive home environments. Our parent workshops teach skills for managing behaviors, navigating school systems, and fostering resilience. We also offer telehealth and hybrid sessions so families across Indiana, especially those in rural areas, can access care without barriers. All of our programs use evidence-based interventions like cognitive behavioral therapy, play therapy, and family systems techniques to ensure treatment is both effective and compassionate. Next slide. Bridging gaps across the lifespan. ANOVA operates on the belief that mental health care should follow families through every stage of life. We connect assessment, treatment, and long-term support to build a continuum of care. That means when a child first receives services, the same support system follows them as they grow, adapt, and transition. We collaborate closely with schools, healthcare providers, and social service agencies to make sure each family receives coordinated and consistent care. By doing so, we help prevent crises and promote lifelong stability for both children and their caregivers. Rooted in systems thinking, our service model is guided by two major theories: Bronfenbrenner's bioecological model and family systems theory. Bronfenbrenner reminds us that a child's development doesn't happen in isolation. It's influenced by their home, school, and community environments. Family systems theory teaches that when one member of a family struggles, the whole system feels it. By combining these perspectives, ANOVA supports not just the child, but the entire family network around them. We aim to create balance, strengthen relationships, and empower families to be active participants in the healing process. Meeting families where they are. At ANOVA, equity and cultural responsiveness are at the heart of what we do. Indiana's families are incredibly diverse, so our services reflect that diversity in every way, from language accessibility to cultural humility training for staff. We provide materials in Spanish and make sure our programs are developmentally appropriate for every age group. Our counselors are trained in trauma-informed care and cultural competency, so every client feels safe, understood, and respected. By meeting families where they are, we create a counseling environment that honors their values and lived experiences. Empowering families, strengthening systems. Ultimately, ANOVA turns theory into action. We believe that when families are supported, children thrive, and when children thrive, communities grow stronger. Our goal is to empower families to build the skills, confidence, and stability they need to sustain long-term well-being. Through collaboration, compassion, and evidence-based care, ANOVA continues to make mental health services more accessible and inclusive for all.
Okay. This is Amataya Okundele Ajibalu. So, legal and ethical foundations of INNOVA. INNOVA's foundation rests on both ethical and legal standards. We are registered as a nonprofit under Indiana law. which ensures transparency and trust. Each clinician holds a valid state licensure under IC 25-23.6, maintaining professional competency and accountability. Ethically, we follow the ACA Code of Ethics, ensuring decisions promote client welfare and justice. These layers, legal structure, and ethical integrity, form the backbone of our operations. Protecting client confidentiality is central to our ethical and legal duties. INNOVA uses HIPAA-compliant EHRs such as therapy notes and simple practice, which include encryptions, access logs, and audit trails. The High-Tech Act extends these protections to detailed communication. Each staff member receives an annual HIPAA training, reinforcing the ACA's emphasis on protecting client privacy. Liability insurance is not just a legal safeguard, it's an ethical responsibility. Every clinician is covered under INNOVA's group policy and maintains individual coverage. Regular supervision and ethical consultations minimize risk and ensure adherence to the ACA's standards of competence and accountability. Record keeping is more than administration, it's an ethical act. Our documentation ensures continuity of care, accurate billing, and legal compliance. All records are encrypted and only have authorized personnel which have access. The ACA code emphasizes that even digital communication, emails, telehealth sessions, and messages must meet the same confidentiality standards as in-person practices. INNOVA ensures that billing practices are ethical, transparent, and client-centered. Fees are clearly communicated in consent forms, and we use sliding scales to accommodate diverse financial situations. Our billing platforms meet HIPAA standards, reducing errors and ensuring fair reimbursement. This reflects our commitment to ACA's directive to treat all clients with fairness and integrity.
Hi everyone, I'm Sarah and I'm going to be talking about building community trust and access. So, INNOVA's outreach strategy focuses on delivering equitable mental health access to diverse and undeserved families. The agency will conduct targeted community outreach events such as workshops and wellness fairs to help families recognize early signs of ADHD and autism and connect them to the resources. These events build trust by meeting families in a familiar community spaces. A mobile counseling and education unit travel across rural and urban areas, providing on-site screenings and consultations for families who face transportation barriers. To further expand access, INNOVA will launch a bilingual hotline and a digital platform with educational materials in both English and Spanish, aligning with the American Counseling Association 2014 Code of Ethics, which emphasizes reducing barriers to care. Finally, the Parent Ambassador Program empowers caregivers of children with neurodevelopmental disabilities to mentor new families, creating a culture responsive and trusted support systems. Next slide, please. So, all INNOVA staff will complete training on trauma-informed practices that address how trauma impacts children, adolescents, adults, and older adults differently. Staff will learn how to create safe and predictable environments and respond to behavioral or emotional distress with calm and supportive communication. This training follows Substance Abuse and Mental Health Services Administration 2014's framework, emphasizing five guiding principles: safety, trustworthiness, choice, collaboration, and empowerment. These principles help ensure that every client interaction supports healing and dignity. Training will not be a one-time requirement. Staff will participate on ongoing workshops, role play exercises, and case simulations, ensuring they can apply evidence-based approaches in real world settings. By continuously reinforcing trauma-informed care, INNOVA ensures that all clients receive developmentally appropriate and culturally sensitive support. Next slide, please. INNOVA's crisis response model recognizes that crisis affects individuals differently depending on age, life stage. For children and teens, interventions focus on safety, emotional regulation, and family involvement. For adults, crisis services addressing balancing caregiving, work stress, and emotional well-being. Among older adults, trauma and crisis can be intensified by health concerns or social isolation. Evidence-based telehealth interventions, such as in-home problem-solving therapy, have shown success in reducing depression and improving functioning among older adults. By tailoring crisis services across the lifespan, Innova promotes recovery, resilience, and equitable access for all individuals, ensuring that no one is excluded from care due to age or circumstance. Next slide, please. Innova's internal crisis plan outlines clear procedures for emergencies, including active shooter incidents, client agitations, suicidal disclosures, or data breaches. Staff preparedness is essential, and Alert Media 2022 emphasizes the importance of pre-planned response strategies such as run, hide, fight, which can save lives during an active threat. Prevention begins with awareness, monitoring workplace behavior, promoting mental wellness among staff, and maintaining open communication to reduce risks. The agency's plan also follows recommendations from CACIVI 2023, who highlights the value of well-defined mental health crisis plans that include early warning indicators, assigned roles, communication procedures, and recovery steps. Innova integrates these elements with community partnerships to ensure coordinated and effective crisis management. Next slide, please. To summarize, Innova's outreach and crisis response plan is grounded in accessibility, trauma-informed care, and coordinated safety. Outreach programs such as community events, mobile counseling units, and parent mentorships extend support to families who might otherwise be overlooked. Continuous staff trainings reinforces SAMHSA's 2014 trauma principles across all age groups, while crisis services adapt to meet developmental needs. Finally, the internal crisis plan, informed by Alert Media 2022 and CACIVI, ensures that both clients and staff are protected during these emergencies. Together, these efforts fulfill Innova's mission to deliver equitable, evidence-based, and compassionate care for all members of the community.
INNOVA works depends on strong partnerships with school, healthcare, and social services. First, we must collaborate with schools like Fort Wayne Community Schools and Indiana School Mental Health Initiative. Schools are often the first place developmental concerns are noticed, so by working with teachers and counselors, we can support IEPs, provide on-site counseling, and reduce stigma around mental health. Second, we partner with IU Behavioral Health. This ensures that children receive coordinated care that connects medical counseling services, integrated care models like this reduce service gaps and improve outcomes for family. Rainey, 2017. Finally, we work with the Autism Society of Indiana. They provide statewide resources, caregiver support, and services across lifespan. This helps families access education, employment, and community support that improves long-term well-being. Together, these partnerships create a seamless system of care for children with ADHD and autism. Advocating for systemic change and care access. At the policy level, INNOVA works to remove barriers that keep families from getting care. First, we push for insurance party so ADHD and autism services are covered the same as other medical needs. Second, we advocate for more state and federal funding to expand behavioral health programs and reduce long wait lists. SAMAS 2020. Third, we work to shorten Medicaid waiver wait time, which can delay autism testing and treat for nearly 2 years. Early intervention is critical for long-term success. Finally, we support policy reforms that ensures equitable access, especially for children of color and those in rural areas who are often underserved. Through these efforts, INNOVA is not just a service provider; it is a voice for systemic change in Indiana. Embedding behavioral supports in schools. At the local level, INNOVA builds partnerships that directly support children and families. We work with school boards to embed behavior support into classrooms and IEPs, which research shows improve both academic and emotional outcomes. Batchman 2024. We join community coalitions to reduce stigma and expand awareness of ADHD and autism, helping families feel supported and connected. And we provide first responder training for police, EMTs, firefighters, ensuring they are prepared to safely and effectively support neurodiverse individuals in crisis. These local efforts make care more accessible, reduce stigma, and strengthen community resilience. Now wrapping up, um, now wrapping up everything and the conclusion. Novo is a collaborative, advocate-driven model that connects schools, healthcare, and social services to provide seamless care for children with ADHD and autism. By combining policy advocacy at the state and federal level with local community engagement, Innovo reduces service gaps and improves outcomes for families. Research shows that integration, collaboration strengthens continuity of care and reduces stigma, helping children and families assess the support they need. Our final message is simple. Funding Innovo means investing in equity, resilience, and accessible care for Indiana families. Thank you.
References. Okay.